Hello, this is Dr. Ashok Thorat. I'm Senior Consultant and Unit Head of the Liver Transplantation Department of SRCC Children's Hospital managed by Narayana Health. On the occasion of Organ Donation Day, I would like to tell you some information about who can be organ donors, what is organ donation, and how it is helpful to save the people who are in need of organ transplantation. One dying person can donate his as much as 8 organs and give life to 8 different patients who are in dire need of organs, otherwise who will die without that. But who can be donor? Anybody, the unfortunate person who is dying, if he's pledged his organ, his relatives in his absence can take this tough decision. I know this catastrophe happens in the family, the person who is dying, it is really tough time for the family members to decide what to do. But if you pledge your organs before that, it will give them a lasting smile that my person, while dying, he saved 8 others people life. The age limit, there is no age limit for this, but any person who is young and healthy can pledge his organs. But the cadaveric organ, that is, disease donor organ transplantation, where the patient is brain dead, is dying of some illness, and he goes in deep coma, and before cardiac arrest happens, there is a time, there is a window period where we can retrieve the organs and save the people who are in the need of organ transplantation. There is also called as living donor liver transplantation. In this, we only take part of your organ. I'm liver transplant surgeon, so in living donor liver transplantation surgery, we take either right side of the liver or left side of the liver. Most of the people, they don't know, like, how is the life after donation of liver, partial liver. People who are healthy, those can donate the organs, and they can be organ donor only when they pass all the tests of organ donation. Living donor I'm talking about. So right lobe living donor or left lobe living donor, after the donation the liver regenerates, and again within 6 weeks it reaches to the original size. There is no long term harm to the donor. He can lead his normal life after 1 or 2 months after transplantation, and at the same time whatever part he gives for his patient, for his recipient, that organ, that liver part also regenerates in 1 to 2 months, and both donor and the recipient, they lead a good life, normal life. And about organ donation, the word we use for cadaveric transplantation, in this the patient is brain dead. For example, if I pledge my organ, but when I am dying, I will not be able to take my decisions. These decisions will be taken by my family if I had pledged my organs. While dying, you can help 8 patients to save their lives. I want to tell you something about living donation. Many people have questions that who can be living donor. Anybody who is your family member, who is your first degree or second degree relative, he can be living donor. A friend, a distant relative which you cannot prove your relation legally, those people cannot be living donors. So in short, if somebody wants to give the part of their life, part of their liver to the recipient, those people have to be blood related, first degree or second degree, or a close relation which can be proven by law. A friend or a distant relative cannot be living donor in this country. It is not allowed. When we select somebody as a living donor, they go through the series of tests. Only when all the tests they pass, they are healthy, then only they are selected as donors. So on this organ donation day, I would like to increase the awareness about importance of your organs. A dying person can save 8 people life. The living donation can be considered among family members to save their patient who is dying because of organ failure. Kidneys and liver, this can be part of living donation. There are 2 kidneys, 1 kidney can be given. There is only 1 liver, either right or left side of the liver can be retrieved, can be donated. So again, on this organ donation day, I pledge my organs and I ask you to do the same. I congratulate all the team members, all the doctors, nurses, medics, paramedics working in this field relentlessly day and night, saving the patients who are in the need of organ transplantation. And I also extend my wishes and regards to the family members who have taken this tough decision of donating their dying relatives' organs and helping other patients and saving their lives. Thank you.